Continuation ng ating discussion this time sa ating blood banking. Kabalik na rin po sa Coombs test wherein yung control for a valid test dapat may agglutination. Sa RH light typing, yung control dapat po walang reaction. Kasi kapag may reaction yung control dito, the test is considered invalid. May reaction po with anti-D, walang reaction with the control. Malinaw po, RH positive. Walang reaction with anti-D, walang reaction with control. Baka RH negative, pero we should first test for the presence of the weak D antigen. Test for the weak D antigen is an example of an indirect Coombs test. Paano naman po kapag may reaction with the control? Katulad na na-mention ko, kabaliktaran ng sa EEG test, kapag yung RH control may agglutination, the test is considered invalid. Patient's red cell with a positive DET. Ano pong in-expect natin dito? Dito po yung patient falsely type as RH positive. Hindi lang po with anti-D yung may agglutination. Both yung anti-D at saka yung control may agglutination, meaning the test is considered invalid. LE gene is FUT3, fucosyl transferase. The LE gene or FUT3 is linked to the secretor gene and each gene located on chromosome 19. Remember, kapag na-inherit mo ang dominant LE gene at dominant secretor gene, ang LE antigen sa red cell natin ay magiging LEB. FUT1, the H gene, FUT2, the secretor gene, and FUT3, the LE gene, all located at chromosome 19. Katulad po na na-mention ko, LE antigen are not considered as red cell antigen. They are produced by tissue cell. They are absorbed by the red cell membrane from plasma. LE antigen are not well developed at birth. Kaya nga yung mga neonates, anong LE phenotype nila? LE A- B- phenotype. Another, ito rin po yung blood group na nag-exhibit ng decreased expression during pregnancy. So, pag tinanong tayo, ano po yung antigen na nag-change or nag-decrease ng expression during pregnancy, Lewis. Yung first individual na inherit ang ABH gene, pero hindi na inherit ang dominant LE gene, non-secretor. Wala po siyang ABH o kanyang secretion kasi non-secretor. Ano pong kanyang red cell phenotype? ABH, AH, BH, H kung group O, at ABH kung group AB. Pero since hindi in-inherit ang dominant LE gene, anong LE phenotype ng ating patient? LE A- B-. What about yung second individual? Yung second individual, na-inherit yung ABH, pero hindi pa rin inherit ang dominant LE gene. But unlike the first individual, yung second individual is a secretor. Anong substance meron siya sa kanyang secretion? ABH, kasi siya isang secretor. AH, BH, ABH, H naman kung grupo. Anong kanyang red cell phenotype? ABH, LE A-B-. Bakit A-B-? Kasi hindi niya na-inherit ang dominant na LE gene. What about yung third individual? Na-inherit ang ABH gene, na-inherit ang dominant LE gene, pero non-secretor. So, since inherit niyang dominant LE gene, meron siyang LEA antigen sa kanyang red cell. Ang LEA, kailan lang magiging LEB kapag ang individual ay isang secretor, kaso po non-secretor. So, anong LE phenotype niya? LEA plus B-. Ano pong substance meron siya sa kanyang secretion? Most of the student would answer none. Kasi nakita yung non-secretor. Ngayon, pag none po ang sagot nyo, mali po yun. Since na-inherit yung dominant LE gene, meron siyang LEA, hindi lang sa kanyang red cell, but LEA, pati sa kanyang secretion. What about yung fourth individual? Yung fourth individual, na-inherit ang ABH, na-inherit ang dominant LE gene, na-inherit ang dominant secretor gene. Remember, kapag ikaw ay isang secretor, ang LEA sa red cell mo ay nagiging LEB. Inheritance of the dominant LE gene and the dominant secretor gene will produce what phenotype? LEA- B+. Anong antigen meron or substance meron sa kanyang secretion? ABH, LEA, at saka LEB. What antigen deteriorate on storage? P or P1 antigen. When older RBC or type are used as control for typing reagent, or when older red cell are used to detect anti-P1 in serum, a false negative reaction may result because P1 antigen deteriorate on storage. For detection of weak antibodies, we can add or increase the ratio of serum to cell. Increasing the ratio of serum to cell increases the sensitivity of the test system. For routine tests, a ratio of 40:1, 2 drop serum and 1 drop of 5% red cell suspension. But for detection of weaker antibodies, we can increase the ratio of serum to cell, like 4 drops of serum to 1 drop of 3% red cell suspension. Rouleau Stock-of-Coin arrangement of red cell. Lahat po ng phases ng antibody screen may Rouleau except yung EEG. Remember, bago mag-add ng EEG reagent, wina-wash ulit yung red cell. Again, Rouleau does not interfere with the EEG phase because the patient's serum is washed away prior to the addition of the EEG reagent. So, anong phase yung walang Rouleau? The EEG phase. Autoantibody. Paano i-remove yung autoantibodies? By means of autoadsorption. Simplest method is adsorption using the patient's red cell or autoadsorption. On autoabsorption, the reaction is complete kapag wala na pong nag-react. But kapag nag-react ulit after autoadsorption, ibig sabihin hindi pa completely na tatanggal yung autoantibodies. So, repeat the procedure, i-auto-adsorb. And, i-auto-adsorb ulit to remove the autoantibody. It is not unusual for 3 to 6 aliquot of red cell to be used for auto-adsorption. Complete auto-adsorption pag wala na pong reaction. Pag may reaction pa, i-auto-adsorb. Paano pag may reaction ulit, i-auto-adsorb. I-auto-adsorb until wala nang reaction ang ma-obtain. For donor deferral, Hepa B immune globulin, the donor is deferred for 12 months. Low volume unit or short draw, pag sinabing low volume unit, 300 to 404 ml of blood in 450 ml blood bag or 333 to 449 ml in a 500 ml blood bag. Low volume unit, pwede po pong gamitin dito yung red cell pero hindi pwedeng gamitin yung ibang component kasi toxic po because of excess anticoagulant. Donor for platelet pheresis. Ano pong criteria for a donor for platelet pheresis? Anticoagulant. Donor for platelet pheresis. Ano pong criteria for a donor for platelet pheresis? Yung donor po should be aspirin-free according to EABB 48 hours. And the platelet count should be at least 150,000 per cubic millimeter or 150 times 10 to the 9 power per liter. The normal platelet count is 150 to 400 or 150 to 450 times 10 to the 9 power per liter. Wash or BC, told red cell, deglycerized red cell, at 1 to 6 degrees Celsius should be administered within 24 hours. Toad plasma sa ref po at ang toad plasma should be administered within 24 hours. Unpooled toad cryoprecipitate room temp, hindi po pwedeng i-ref kasi pag na to, hindi na pwedeng ibalik sa ref or sa freezer kasi magpo-precipitate ang factor 8 Ang tooth plasma should be administered within 6 hours. Tooth plasma should be administered within 24 hours. Tooth cryoprecipitate at room temp should be administered within 6 hours. Cryoprecipitate after pulling and then thawing should be administered within 4 hours. And pool platelet should be administered within 4 hours unless ma-mention po yung new technology of pulling the platelet in a closed system. Pag ganun po, 5 days po. Tooth plasma sa ref, 1 to 6 degrees Celsius, it should be administered within 24 hours. Tooth cryoprecipitate, hindi na po pwedeng ibalik sa freezer. Room temp lang po, 6 hours. Cryoprecipitate after thawing and then pulling, 4 hours. Pool platelet should be administered within 4 hours unless ma-mention po yung bagong technology of pulling the platelet in a closed system. Pag ganun po, 5 days. For whole blood transfusion, the donor and the recipient should be ABO identical. For red cell, remember, yung mga group O, universal donor. Group A, pero pag group O, kakatulad ko, sino lang dapat ang donor mo? Ang group O, pag A or group O, B or group O, AB or O. In a group AB patient, the universal recipient, ang first choice po is AB. Second choice A, third choice B, last resort, group O. Isa-save po natin yung una blood kasi mas marami po tayong patient na group O. So yung baka po nalito kayo pag hindi nyo alam yung blood type, dun po pwedeng group O. Pero pag alam mo na AB, ang first choice AB, ang second choice A, ang third choice B, at ang last resort, group O. Isa-save po natin yung group O na blood kasi mas marami po tayong patient na group O ang blood type. Ibang usapan naman po pag plasma. For plasma, the universal donor is AB. Kasi yung AB po ng AB plasma ay walang anti-A, walang anti-B, provided walang significant amount ng red cell. Kapag na-mention po yung platelet, in an emergency, if group-compatible platelets are not available, any blood type can be given if the patient is over 2 years of age. So, may patient, ito yung ABO type, walang ABO compatible na platelet. Pwede po yun pag platelet. Any type can be given if yung patient natin is over 2 years of age. Ano naman po yung unit na hindi nagre-require ng compatibility test, cryoprecipitate, pwede po itong ibigay kahit hindi group specific. For plasma, ang D positive or RH positive patient, pwede mag-receive ng RH positive or RH negative na plasma. Yung mga RH negative na patient, pwede rin po mag-receive ng RH positive na plasma, pero preferred po yung D negative. Bakit? Kasi yung RH antigen nasa red cell, wala naman po sa plasma. For investigation of transfusion reaction, remember, what is the most common cause of fetal transfusion reaction? Clerical check. So, first step in the investigation of transfusion reaction, clerical check. Pangalawa po, igagather na natin yung mga sample needed for the investigation of transfusion reaction. Patients, pre-transfusion blood sample, patients post-transfusion blood sample, patients post-transfusion urine. Uulitin po yung blood typing, yung cross-match compatibility test, just in case bacterial contam. Isa pa po sa mga specimen collected, apat po is the blood bag. ABO, RH typing, compatibility test, kung bacterial contam, pwedeng i-Gram-Stein, pwedeng i-culture. First step is clerical check. Ano po yung mga i-gather? Bali, 4 po. Patient's pre-transfusion blood sample, patient's post-transfusion blood sample, and the blood bank. Hindi na po kailangan dito ng another sample from the donor. Take note, isa sa mga test na pwedeng gawin, test for serum bilirubin. Kailan po ito ginagawa? 5 to 7 hours after transfusion or average of 6 hours. Serum bilirubin and samples should be drawn 5 to 7 hours after transfusion. Now, bilirubin is a marker for red cell lysis. Bilirubin peaks at 5 to 7 hours after transfusion and is back to pre-transfusion level at 24 hours if liver function is normal. Again, when do we measure bilirubin? Because the question, 5 to 7 hours, an average of 6 hours. Remember, si mother Rh negative, si child Rh positive. Hindi po kaagad magbibigay ng rugam. We should screen for fetal-maternal bleeding. Ano po yung qualitative or screening test for fetal-maternal bleed? The Rosette test. The D indicator cell will form rosette around the positive red cell. Kapag positive po ang Rosette test, magpo-perform na po tayo ng quantitative test for fetal-maternal bleed kasi magko-compute tayo ng number of Rogam vials katulad ng Krehauer-Bethke test, ELAT, flow cytometry. Una muna, kapag si nanay Rh negative, si child Rh positive, we should check or determine the amount of fetal-maternal bleed. Screening test for fetal-maternal bleed, the D Rosette test. The D indicator cell forms rosette around the positive red cell. Kapag positive, magpo-perform po tayo ng quantitative test, Krehauer-Bethke test, ELAT, or flow cytometry para makompute yung number of Rogam vials na ibibigay. Paano po pag negative yung Rosette test? Ang question po dito yung sensitivity ng Rosette. Kapag si mother Rh negative, si child Rh positive, kahit negative, ang D Rosette test, magbibigay tayo ng 1 vial of Rogam for protection or prophylaxis. Nung araw po, pag tinanong to assess kung gaano ka-severe yung HDL, remember, pwede tayo mag-perform ng amniotic fluid bilirubin or OD450. Yung mga result po, pinaplot sa Lilly graph. Naalala niyo po, Zone 1, not affected fetus. Zone 2, moderately affected fetus. And Zone 3, severely affected fetus. Pero ngayon po, paano na po ito ginagawa? For OD450, ang pinakasample po kasi doon, amniotic fluid. So, magko-collect pa ng amniotic fluid. So, ngayon to assess for fetal anemia due to hemolysis, pwede po yung Doppler ultrasonography. Fetal anemia caused by hemolysis of RBC during pregnancy can be detected by ultrasound technique, specifically by the Doppler ultrasonography, which can be used to measure the blood flow velocity. Unlike po nung araw na amniotic fluid bilirubin or OD450. Salamat po, hanggang dito po muna ang ating discussion. Recap, but these are questions taken from BOC Schulenhor. Number 1, what is linkage disequilibrium? According to BOC, linkage disequilibrium result when gene occur more frequently in a haplotype than is expected based on a chance alone. This is commonly seen in the HLA system. If you'll notice, yung A at saka C almost the same, pero ang keyword natin, yung word na more often. Yung sa C po kasi nakalagay less often. So, correct answer A. Occurrence of HLA genes in the same haplotype more often than would be expected based on gene frequencies. Next, the phenomenon of an Rh-positive person whose serum contains anti-D is best explained by, remember, sino po itong person na to? Itong person na to ay partial or masig D. Remember, yung partial D or masig D, siya yung type ng weak D na pwede mag-produce ng antibody. An antibody to the missing fragment. The D antigen is a mosaic structure. If one or more fragment is missing, it can result to weakened expression of the D antigen. So, correct answer B, missing antigen epitope. Individuals who are partial D or mosaic D or missing epitope of the D antigen and can develop antibodies towards the epitope that they lack. Since all normal D antigen have all epitope the specificity of the person's antibodies anti-D. Number 3, which of the following is useful for removing IgG from an RBC of a patient with a positive DAT to perform a phenotype? Remember, in DAT, yung patient's red cell are coated with antibodies in vivo. So, paano mo i-phenotype yung red cell na coated with an antibody? So, tatanggalin po natin yung antibody pero dapat intact yung RBC. Now, the two reagent used for removing IgG from the RBC are chloroquine, diphosphate, and glycine acid or EGA. Using either of these procedure is useful to reduce a patient's DAT and allow phenotyping or blood typing in an indirect EEG test reactive anti-sera. Again, the two reagent which can be used to remove the coating IgG antibody from the red cell to allow its phenotyping are chloroquine diphosphate and glycine acid, CDP, and EGA. Next, which of the following blood component must be prepared within 8 hours after phlebotomy? A question lifted from BOC. Fresh frozen plasma. Fresh frozen plasma must be separated and frozen within 8 hours of whole blood collection. A question lifted from HAR. A unit of whole blood is collected at 10 a.m. and stored at 20 to 24 degrees Celsius. What is the last hour platelet concentrate may be made from this unit? Remember, ang tinutukoy po dito random donor platelet. Ang random donor platelet is prepared from whole blood. Paano mag-prepare ng random donor platelet from a whole blood? Light spin followed by a hard spin. In preparation of blood component, pwede po tayong gumamit ng refrigerated centrifuge except when preparing for platelets. Bakit? Kasi yung mga platelets po must remain at room temperature. Kaya nga po pag pinag-uusapan yung bacterial content, ano yung blood component na pinaka-prone sa bacterial content? Platelet. Because platelet are stored at room temperature. Yung mga platelet prepared from whole blood must be prepared within how many hours of collection? Within 8 hours. So, kung 10 a.m. po to at room temp, kailangan po siyang, so 10 a.m. plus 8 hours, kailangan po siyang ma-prepare within 6 p.m. Whole blood used to prepare platelet concentrate must be drawn by a single non-traumatic venipuncture, and concentrate must be prepared from whole blood within 8 hours of collection. Next, when employing the urine reagent strip method, the falsely positive protein may result or may occur in the presence of, remember yung protein pad natin is buffered at what pH? pH of 3. It is citrate buffered at pH of 3. So ano po dito ang pwede mag-cause ng false positive reagent pad? Ang pinag-uusapan po dito yung reagent pad for protein, a highly alkaline urine. The protein pad must be held at a pH of 3 in alkaline urine. The pH of 3 may be neutralized and the indicator may change in color, producing a false positive protein result. Next, a patient's urinalysis reveals a positive bilirubin and decreased urobilinogen level. These results are associated with just a review of the three types of jaundice. In hemolytic jaundice, anong bilirubin fraction ang elevated? Unconjugated bilirubin. In hepatic jaundice, anong bilirubin fraction ang elevated? Unconjugated or conjugated bilirubin. In obstructive jaundice, anong bilirubin fraction ang elevated? Conjugated bilirubin. Remember, anong bilirubin fraction ang nag-appear sa urine? Conjugated bilirubin. Remember, in hemolytic jaundice, anong bilirubin fraction ang elevated? The unconjugated type. So, urine bilirubin is negative, urine urobilinogen is positive. In hepatic jaundice, anong bilirubin fraction ang elevated? Unconjugated or conjugated bilirubin. In hepatic jaundice, ang urine bilirubin could be negative or positive. Kailan siya positive? When the conjugated bilirubin is already elevated. Urine urobilinogen is positive. In obstructive jaundice, ang urine bilirubin is positive. Siyempre naman po kasi may elevation po dito ng conjugated bilirubin. Ang urine urobilinogen is negative or decreased. Pero kahit negative or decreased po ito, ang reading na makukuha natin sa strip ay normal. Bakit? Yung reagent pad po natin for urobilinogen ay hindi ginawa to detect decreased value. Ginawa lang po siya to detect increased value. So kahit negative or decreased ito, ang reading na makukuha natin ay normal sa reagent pad. So ano po yung analyte na never ni-report as negative sa urine? Urobilinogen. So ang tanong po, positive urine bilirubin, decreased urobilinogen, ano po ito? Obstructive jaundice. So, anong tama pong sagot dito? Biliary obstruction. Using polarized microscopy, which of the following urinary elements are birefringent? Remember, yung triglyceride or neutral fats are stained with Sudan or oil red O. Ang cholesterol, they are not stained with Sudan or oil red O, but under a polarizing microscope, yung mga cholesterol-containing cells and cast ay mag-exhibit ng characteristic multi-cross formation. Ano pong halimbawa nito? Yung mga oval fat bodies at saka fatty cast containing cholesterol ay mag-exhibit ng characteristic multi-cross formation under a polarizing microscope. So, cholesterol, correct answer cholesterol, cholesterol is capable of polarizing light. Another, which of the following would be evidence of successful vasectomy? Pag sinabi pong vasectomy, kinakat yung or binablock yung vas deferens para po yung ejaculate wala ng laman na sperm. It is a means of contraception. Unlike with fertility studies, the time and temperature is not critical. Inuulit ko po, unlike in fertility studies, time and temperature is not critical. This is done 2 months after vasectomy and continued until 2 consecutive monthly specimens show no sperm. So yun lang po ang hinahanap natin, presence or absence of sperm. Now the presence of sperm is considered significant. Even one sperm is considered significant. So evidence of successful vasectomy dapat po yung ejaculate wala ng laman ng sperm. So, anong correct answer po dito? Azoospermia. After a successful vasectomy, there should be no sperm present in the ejaculate. Azoospermia. A critically ill patient becomes comatose. The doctor believes the coma is due to hepatic failure. Hepatic coma. The assay most helpful in the diagnosis of. Remember, ammonia can be used in the diagnosis of hepatic encephalopathy. So, correct answer, letter A. Next, Total glycosylated hemoglobin level in hemolysis reflects our blood glucose concentration in the past 2 to 3 months. Remember, there are two ways to monitor a patient with diabetes mellitus: glycosylated hemoglobin long-term monitoring of patient with DM, a reflection of our blood glucose for a period of 3 months, pero ang glycosylated hemoglobin is affected or influenced by the RBC survival. So yung mga condition that causes hemolysis or decreased RBC survival, so decreased glycosylated hemoglobin. Ang fructosamine glycosylated albumin, a reflection of our glucose for a period of 2 to 3 weeks. Unlike our glycosylated hemoglobin, ang fructosamine is unaffected by hemolysis. So ano po yung appropriate test to monitor a patient with DM also suffering from hemolytic anemia? Fructosamine. Ano po yung tatandaan? Decreased glycosylated hemoglobin in hemolysis, kasi ang glycosylated hemoglobin is affected by the RBC lifespan. So yung mga patient with DM also suffering from hemolytic anemia, to monitor this patient with DM, instead na glycosylated hemoglobin, pwede po ang fructosamine. Which of the following lipid would be expected to be falsely elevated on a serum from a non-fasting patient? Triglyceride. Food intake can cause a transient increase in triglyceride level by 50%. Turbidity in serum suggests elevation of chylomicrons. Remember, turbid or milky serum after eating. Postprandial lipemia is due to triglyceride. Remember, what is the major carrier of dietary or exogenous triglyceride? Chylomicrons. So, postprandial lipemia, chylomicrons. Pag wala po nito, pwede po tayong sumagot dito ng lipoproteins. Another analysis of CSF for oligoclonal bands is used to screen for which of the following disease states. Bakit po tayo nag-electrophoresis ng CSF? Kasi naghahanap po tayo ng oligoclonal bands. These are bands at the gamma region of both CSF and serum. Now, the presence of 2 or more oligoclonal bands in CSF but not in serum is indicative of multiple sclerosis. Again, what are oligoclonal bands? These are bands in the gamma region of both CSF and serum. Now, the presence of 2 or more oligoclonal bands in CSF but not in serum is indicative of multiple sclerosis. Correct answer letter B. Pero tatandaan po natin, hindi lang po multiple sclerosis ang may oligoclonal banding, but also other conditions like neurosyphilis, encephalitis. A follow-up question, oligoclonal bands are present both in CSF and serum. The proper interpretation is, hindi po tama dito yung letter B. Kasi hindi lang po multiple sclerosis ang may oligoclonal banding, at saka po, dapat po in multiple sclerosis, 2 or more bands. In CSF, but not in serum. So ano pong correct answer dito? D, this is non-diagnostic for multiple sclerosis, so they need further testing to rule out multiple sclerosis. Oligoclonal proteins are produced not only in multiple sclerosis but also in other demyelinating diseases. In addition to carcinoma of the prostate, elevated PSA can occur due to hindi lang po in prostatic cancer, elevated ang PSA, but also in other conditions such as benign prostatic hyperplasia, prostatic infection irritation following DRE, digital rectal exam, or it may also be elevated after recent ejaculation. PSA can be elevated due to benign prostatic hyperplasia, prostatic infection, irritation following digital rectal exam, or even after a recent ejaculation. So, correct answer letter C, benign prostatic hyperplasia. For PSA, the normal value is 0 to 4 nanogram. Ang pinaka-cutoff po dito is 4 nanograms. Another, the drug prokinamide is prescribed to treat cardiac arrhythmia. What biologically active liver metabolite of prokinamide is often measured simultaneously? Prokinamide is a cardioactive drug used to treat congestive heart failure. Metabolite of prokinamide is NAPA or N-acetyl prokinamide. Correct answer letter C. Phenobarbital is a metabolite of primidone. Primidone is an anticonvulsant drug, an anti-epileptic drug used to treat seizure, and one of the metabolites of primidone is phenobarbital. Which of the following is associated with pseudopellureate anomaly? Ang hyposegmentation ng neutro can be inherited or acquired. Inherited hyposegmentation is known as Pelger-Hewitt anomaly, or acquired hyposegmentation is also known as pseudopelger-Hewitt anomaly. Pseudopelger-Hewitt anomaly can be seen in myeloproliferative disorder, for example, yung mga patient with CML. Correct answer is C, myelogenous leukemia or chronic myelogenous leukemia. Another, the leukemic phase of T-cell lymphoma is marked by the following cellular abnormality. Ang tinutukoy po dito, Sézary syndrome. Sézary syndrome, mycosis fungoides, T-cell lymphoproliferative disorder. Ano po yung cell present in Sézary syndrome, mycosis fungoides? Sézary cell. These are lymphocytes with cerebriform nucleus. Pag sinabi pong cerebriform, brain-like nucleus. In addition to an increase in RBC, which of the following is characteristic of polycythemia vera? Remember, in polycythemia vera, panhyperplasia, elevated po ang mga blood cell, lahat ng blood cell, both sa bone marrow and peripheral blood. In polycythemia vera, elevated po lahat ng blood cell, elevated ang red cell, elevated po ang WBC, at elevated po ang platelet. Pero remember, ano po yung renal hormone that stimulate bone marrow production? Erythropoietin. In polycythemia vera, decrease po ang erythropoietin. How come elevated yung red cell pero decrease erythropoietin? Ito po yung proof ng polycythemia vera is a myeloproliferative disorder. Asan po ang defect dito? Nasa patient's bone marrow. So, in polycythemia vera, elevated ang red cell, elevated ang WBC, elevated ang platelet, pero decrease erythropoietin. So, correct answer letter D. So, pag tinanong po tayo, ano po itong condition na ito, na elevated RBC, decrease erythropoietin, polycythemia vera. Type of polycythemia in a severely burned patient. Yung mga brain patient po can suffer from dehydration. So, ano tong type of polycythemia na elevated? Yung red cell, pero normal ang RBC mass. Paano po nangyari yun? Normal ang RBC mass because of decreased blood volume. This type of polycythemia can be seen in dehydration. Relative polycythemia. In relative polycythemia, elevated ang patient's hematocrit, normal RBC mass. Bakit mataas ang hematocrit? Not because of increased RBC mass, but because of decreased plasma volume. For example, in dehydration. Correct answer letter C. relative polycythemia associated with dehydration. Next question, a patient has his coagulation blood sample drawn from a line. This is the only option for obtaining the sample. The PT is normal at 11.5 seconds. Remember the normal value for PT, the reference range for PT is 11 to 14 seconds. For APTT, 25 to 35 seconds. For thrombin time, up to 21 seconds. So, normal po yung PT, prolong yung APTT kasi 60 seconds. Prolong din po yung thrombin time at 30 seconds. So, normal APTT is 25 to 35 seconds. Normal thrombin time is up to 21 seconds. Ang pinaka-keyword po dito, sample taken from a line. IV, intravenous catheter. For coagulation test, itong IV catheter should never be flushed with heparin. It should be flushed with saline. But, assuming nag-occur yung heparin contam, kaya elevated yung APTT, what to do next? Thrombin time, this is to check kung heparin contam. If the thrombin time is elevated, anong pwede pong gawin dito? Pwede po natin inutilize yung heparin. Ang heparin kasi pwede mag-cause ng error sa mga different coagulation studies. So, correct answer, heparin, neutralization should be done. Heparinase or hepcyme. Plasma-containing heparin may produce false positive lupus anticoagulant screening test, inhibitor effect on factor assay, and a variety of other interferences. A heparin neutralization procedure should be performed, which would enable testing to proceed. A question lifted from BOC, the following tracing is from a cardiac surgery patient using thromboelastography. The tracing indicates, ito po yung picture, take note, yung black po yung control, yung green po yung patient result. According to RODOC, thromboelastography is a global whole blood analyzer that measures the clotting time and dynamic, clot strength, anti-thrombotic effect, platelet effect on clot dynamic and strength, and fibrinolysis. Thromboelastography can be used in liver and cardiac surgeries. Analysis of tracing determine the speed, the strength, the stability of clot formation, as well as the effect of fibrinolysis. Ito po yung tracing na nakita ko po sa internet, the normal tracing, and a tracing with heparin warfarin. Kung mapapansin po, yung second picture is identical dun sa given from BOC. Heparin, warfarin, remember this, are anticoagulant drugs. Balikan po natin yung picture. Ito po, the normal tracing, yung control, at yung green yung patient. Sa picture po natin kanina, napansin po natin kahawig nun sa heparin warfarin. Therefore, ano pong answer dito? Patient is sufficiently anticoagulated. So, ipopost ko na lang po mamaya itong mga picture na to para maging familiar po tayo kahit ako po sa different tracing from obtained in thromboelastography. Which testing platform meet this description? An isolated colony is irradiated by a laser which ionizes the biomolecule and causes them to become accelerated in an electrical field. The ionized biomolecule then enter a flight of tube where they are separated by their mass to charge ratio. Malditov. Remember, ano po yung technology utilized sa Malditov? Mass spectrometry. Balikan po natin yung discussion natin kanina, Malditov mass spectrometry or Malditov MS. Mass spectrometry is a technology that will allow rapid identification of microorganisms. Identification of microorganism can be accomplished within minutes from isolated colonies. Yun nga lang po ang drawback nito, kailangan po nating mag-culture. Once the instrument has been purchased, MALDI-TOF is of very low cost. So rapid identification, low cost, one of the drawback, kailangan pa rin po ng colony, kailangan pa rin po mag-culture. Correct answer, MALDI-TOF, MS. PCR is extremely sensitive, but testing is often complicated by a question lifted from BOC. Isa sa mga or one of the greatest error in PCR is contamination. Contamination of sample may yield a false positive result. Contamination of sample can result in amplification of contaminant during PCR. This continues to be a leading complication with this testing method, contamination. Another question obtained from BOC, the antimicrobial susceptibility test for Klebsiella pneumoniae isolated from a pleural fluid had the following result. Susceptible to amikacin, susceptible to ampicillin, susceptible to cefazolin, susceptible to cefoxitin, susceptible to gentamicin, susceptible to tobramycin. The next best test is 2. Kung Klebsiella pneumoniae ito, according to BOC, usually ang Klebsiella pneumoniae are resistant to ampicillin. So correct answer, letter B. Verify the result as it is unusual for Klebsiella pneumoniae to be susceptible to ampicillin. BOC, Klebsiella pneumoniae is usually resistant to ampicillin. Usually resistant to ampicillin, Klebsiella pneumoniae. Correct answer, letter B. Last, using a fluorescent microscopy, a wet preparation of skin tissue reveals fluorescent septityphi. The smear was prepared using chalcofluor white. Ang chalcofluor white can be used for fluorescence microscopy. Specifically, chalcofluor binds to the fungal cell wall, particularly to the cellulose and chitin component. Chalcofluor white fluoresces when exposed to UV light. Hanggang dito muna po ang ating discussion. Salamat po sa lahat. Thank you.